Family history and melanoma risk. A comprehensive case study of diagnosis and genetic considerations. Case presentation. Patient, a 45-year-old individual. Chief complaint, a newly discovered mole on the back. History, the patient reveals a family history of melanoma, with 2 close relatives diagnosed with the condition. Clinical examination, the mole exhibits characteristics suggestive of malignancy, prompting a biopsy. Investigations, the biopsy confirms the diagnosis of melanoma. Genetic testing reveals mutations associated with melanoma, including CDKN2A, CDK4, BRAF, and NRAS genes. Discussion, family history of melanoma significantly increases the risk of developing melanoma. Genetic mutations in CDKN2A, CDK4, BRAF, and NRAS genes contribute to this risk. Approximately 10% of melanoma cases can be traced to inherited genetic factors. Genetic conditions associated with melanoma. 1. Familial atypical multiple mole melanoma syndrome, FAMMM, often associated with CDKN2A mutations. 2. Xeroderma pigmentosum, XP, a condition that increases sensitivity to UV radiation, increasing melanoma risk. 3. Li-Fraumeni syndrome, predisposes to various cancers, including melanoma. 4. Hereditary melanoma, associated with CDKN2A and CDK4 mutations. 5. Werner syndrome, a premature aging disorder that can increase melanoma risk. Genetic testing for melanoma. Genetic testing in melanoma includes the examination of specific genes known to be associated with the disease. It is done through a blood test or saliva sample. 1. Targeted testing looks at specific genes known to have mutations that increase melanoma risk, such as CDKN2A and CDK4. 2. Comprehensive testing, a broader examination through panels that look for mutations in multiple genes associated with melanoma. 3. Counseling, genetic counseling before and after the test to understand the implications of the results, the inherited risk, and prevention strategies. Statistics and facts. 1. Approximately 10% of melanoma cases can be traced to inherited genetic factors. 2. The most common inherited genetic mutation associated with melanoma is in the CDKN2A gene, followed by the CDK4, BRAF, and NRAS genes. Conclusion: understanding a patient's family history, associated genetic conditions, and genetic predispositions can guide personalized care and interventions, optimizing outcomes. For further reading, for more information on melanoma and the role of family history, consult resources such as the American Cancer Society, the Centers for Disease Control and Prevention, CDC, or medical literature available through libraries and online databases like PubMed.